On our phone lines, we have some folks from the Billings Clinic here in Billings, Montana. We're talking with Dr. Mark Lee, who's the director of the Internal Medicine Residency program at Billings Clinic, and also Dr. Virginia Mohl. Good morning. How are we doing this morning?
Morning.
Yeah. Well, I've always been enthralled by the residency program up at Billings Clinic because there's a shortage of doctors across the United States. So how is the Billings Clinic tackling that?
Well, as you may know, we are now recruiting, we've just recruited our sixth class of internal medicine doctors. And our mission is to really train the next generation of internal medicine doctors to care for the medically complex, to serve ultimately rural Montana and the region. And we've been very successful in that endeavor. In fact, this year, our graduating class, one is going into rheumatology and is doing a fellowship at University of Colorado, but we've already hired her to come back to be one of our rheumatologists when she completes her training. The rest of our trainees are doing internal medicine either as primary care or in hospital medicine, and we are fortunate to recruit three to actually stay with us in the region. So we've been very productive in this endeavor, and we're very happy with the quality of the applicants and our graduates who are coming out.
When we talk about doctors, I think these days and times more doctors are going into specialties like cardiac surgeons and this and that. Is that where you're finding a little problem where there's not enough doctors across the United States or even here in the state of Montana?
There is a national shortage of physicians in rural America, let alone rural Montana. Most of Montana is considered rural. One of the benefits of having an internal medicine residency, a lot of people are unaware of the training that it requires to be a specialist like a cardiologist. You have to start with college, then 4 years in medical school. Then you have to, after medical school, you get into a residency program, and internal medicine is a prerequisite to do specialties such as cardiology, rheumatology, not necessarily surgical fields, but there are about 22 specialties that come off of internal medicine itself. So in order to do cardiology, you would have to do 3 years of internal medicine, the training here in Billings, and then you'd have to do another 4 to 5 years of additional fellowship training to be board eligible in cardiology. So we are actually a stepping stone to many of the subspecialties that people refer to. And even though Montana is in desperate need of primary care doctors in our region, we also need specialists, and that's a big problem too, because we need to have specialists to help support the care the primary care doctors are providing.
Dr. Mohl, how important is this program to the Billings Clinic?
It's not only important to the Billings Clinic, but it's important to our region. We talk about in the 2 decades before we started the internal medicine residency, I think we recruited 2 internists who are now still with us. So in 2 decades, with all I always say with all the resources of the Billings Clinic, we were only able to recruit a couple of primary care internists. So creating this program was critical. Not only are the internists and the residents staying in our area, but the fact that we have a residency program meant that we were able to recruit a lot of board-certified internal medicine physicians, over 20, who are now part of our program and helping to educate not only the residents here in Billings, but also in 2 rural sites, one in Montana in Lewistown and one in Sheridan, Wyoming.
So, Doctor, where do you see this program in 5 years?
Dr. Lee has great plans for this program that are really going to help us address many of our healthcare needs.
With that, I'll say that I would love to be able to ultimately expand the program. Coming out with 8 doctors in internal medicine per year is not enough to serve the need of even rural Montana. We've been very successful in retaining about 40% of them, our graduates in the region. But on top of that, I would ultimately like to explore the possibility of having fellowship training courses. Those are anywhere from 2 to 5 years of additional training in specialties like, for example, rheumatology or cardiology. No specific plans have been made, but those are some aspirations that I have for the program.
What specialty, well, maybe we'll just look at the state of Montana, or maybe nationwide, there's the biggest shortage?
So if you look at the AAMC data, the most recent AAMC data, we don't have a wealth of specialists. There are less than 100 cardiologists in the state of Montana, and I don't recall the exact number, but what surprised me is a good proportion, over half, are within retirement age in the next 10 years. And unfortunately, we don't have a pipeline to replenish those specialists. And that data is emulated in other specialties like rheumatology, infectious disease. Those areas, we're at great risk of a huge attrition just from retirement as time goes on. And hopefully, having additional programs in Montana will be helpful in replenishing those stores.
From the time this program started to right now, what has been your biggest surprise?
The biggest surprise for me, and my family, we're from Montana ultimately, is how much the community has come together to support the training programs here. I have patients that will approach me on the street, and they realize I was a program director, and they say, "Wow, I see Dr. X in your clinic, and they're awesome. I hope that they stay." And so to see how our community has really embraced our mission in bringing internists and training them in Montana, hopefully retaining them here, is really warm to my heart, because we're all Montanans, and I see that as a big plus to see it's not only our institution, but it's our community that supports this.